A child waited 8 years for a heart. Your clinic may be waiting 60 days to get paid. The problem is more connected than most healthcare leaders realize. A 9-year-old boy named Tyven Mac Gab recently received a heart transplant after waiting 8 years for a donor heart. 8 years of uncertainty. 8 years of medical appointments. 8 years of hoping for one phone call that could change everything. When that call finally came, thousands of people, decisions, and processes had to work together. A donor family, a clinical team, a healthcare system, one life changed because the connections worked. That story reminds me of a challenge facing physician practices every day. Healthcare does not always have an innovation problem. It has a friction problem. We continue adding more technology, more systems, and more complexity. But physicians and staff often experience something very different. More clicks, more paperwork, more administrative burden, more time fixing problems that should have been prevented. Here is the uncomfortable truth. Medical billing is not just a billing problem. It is a data quality problem. A denied claim is usually not where the problem started. It often began earlier: incomplete documentation, disconnected workflows, missing information, poor communication. The healthcare industry spends enormous energy fixing problems after they happen. But the greatest opportunity may be preventing them upstream. The same principle applies everywhere in healthcare. A patient does not experience your departments, software, or workflows. They experience one journey. Was it easy? Was it clear? Did someone help? The future of healthcare will not belong only to organizations with the most advanced technology. It will belong to organizations that create the simplest experience. Clean information, connected systems, better workflows, less friction. Artificial intelligence and automation will continue changing healthcare. But technology only amplifies the foundation underneath it. A broken workflow with advanced technology is still broken for physician owners. The question is not only how many claims are being denied. The better question is, why did the problem happen before the claim was created? Find the friction, fix the source, improve the experience. A child waited 8 years for a heart. Every healthcare organization has its own version of waiting. Patients waiting for answers, physicians waiting for better systems, clinics waiting for payments. The next great healthcare innovation may not be something we add. It may be something we finally remove. What is the biggest source of unnecessary friction in your healthcare organization today? Documentation, administrative workload, insurance processes, disconnected systems. Share your experience in the comments. If this perspective resonates, consider reposting to help more physicians and healthcare leaders rethink how operational challenges affect patient care.